Welcome to our In Conversation. It's a privilege to be speaking with Anne Burgess AM and Robert Fitzgerald AM. They are indeed big names when it comes to tackling elder abuse. Anne is the chair of the Aged Care Council of Elders. She is the chair of South Australia's Aged Rights Advocacy Service, ARAS, and the deputy chair of the Older Persons Advocacy Network, OPAN. Anne is also the Deputy President of COTA SA and a member of the National Aged Care Advisory Council. Robert Fitzgerald is the Age Discrimination Commissioner at the Australian Human Rights Commission. He's been in the job since April. He's the former New South Wales Ageing and Disability Commissioner. He served as a commissioner on the Royal Commission into Institutional Responses to Child Sexual Abuse and a commissioner at the Productivity Commission over many years. At the Productivity Commission, he conducted multiple inquiries, including into the care of older Australians, National Disability Agreement, and Australia's health workforce. Welcome, both of you. Thanks for joining us. And what don't we talk about? What keeps you awake at night when it comes to elder abuse?
So lots of things keep me awake at night. Is that working now? Yeah? So thank you. Lots of things keep me awake at night. But when I think about elder abuse, having been involved in it for a long time, the one thing that comes to me is about shame. So I put myself in the shoes of an older person with grown adult children, and we know adult children are most often perpetrators of elder abuse. And I think of those older people who can't divorce, you can never divorce your children. You know, they're with you forever. You're forever their parent and you can't divorce them. And the shame that goes with having to say, this is what this person is doing to me. And so, you know, we'll talk probably about the stats, but we know like 1 in 6. And then we know, as I think Mark Dreyfus said this morning, only 1/3 of those reports. So what's at the basis of that? And I think we have to think about how to deal with the shame, how to make it, and we can learn from child protection in this, we can learn from DV in this, we can learn from mental illness that used to carry a huge amount of shame with it. So how do we make that more openly spoken about? And shame in certain cultures, Indigenous cultures, in certain multicultural groups, is even more pronounced. So that's a concern to me. And the second thing I want to say is, how on earth do we still not have a national register for powers of attorney? How on earth? After all this time, after years and years and years, this is something we really have to get right. So those are my two.
Thank you. Well, Robert, what about you?
Well, I know what's going to keep me awake tonight. That's sitting here in front of Kay Patterson. I feel like the teacher and the student, and if I get it wrong, she's going to mark me down.
That's a direct eye line, I'm saying.
I know. It's very threatening.
Yeah.
I'll come back to shame later, I think, in the conversation. But the big thing for me, having spent 5 years as the Ageing Disability Commission, which is the adult safeguarding body in New South Wales, is neglect. And neglect is pervasive, but it's also the one that is least seen. Neglect often starts with good intent. A son or daughter, particularly in culturally diverse communities, is either put up as the person that will care for the ageing person, or by circumstances, is the only one left to be able to do that. And often they're completely incapable, unsupported, and not able to take on the task. And so what we see is this gradual decline in the level of care of the individual within their own home. The family always says, oh, well, you know, we're supporting mum and dad. We always look after the elderly. But the truth is they don't do anything. They tell the daughter how bad she's doing, or the son what a poor job he's doing. And this decline continues. And with neglect, the real tragedy is, of course, it's the withdrawal from society, the withdrawal from health services, the withdrawal from social networks, the withdrawal from all sorts of support. And then a very perverse thing happens, is the stopping of in-home supports, because it's embarrassing, it's humiliating. And so as this decline continues, the person needs more support and gets less. And of course, ultimately we see illness, hospitalisation, death, and of course death notices always say pneumonia. They never say malnourishment. And so one of the great things going forward is how do we deal with this increasing level of neglect, not only of people that are isolated, but that people are living with family members. And it's the one thing that worries me. It worries me with children, and it certainly worries me in relation to the space of elder abuse. It's not the biggest area, but it's certainly the most hidden.
I know it's only been a year, Anne, but as Chair of the Council of Elders, you have a direct voice to government. How does that work, and what's your ambition in the role?
So, and I'm looking at some members of Council of Elders who are here with me today. So Council of Elders is this fabulous group of 14 people from around the country with an age span of mid-70s to mid-90s, hugely diverse, with, you know, a whole range of experiences. That's one of the things I think is really important. We talk too often about older people as though they're one grey melange all the same. You know, they're a lump, older people. And instead of that, of course, you know, every older person has a different life and experiences, and that's what we have around the table. Those people, with me being lucky enough to be the chair, we bring our experiences and views and those of all our networks to the aged care reform process that's going on at the moment. And the Royal Commission was suggested that there should be a Council of Elders because they recognised that the voices of older people were not being heard, were the bureaucrats, the providers, the people who were designing services were doing that without the voices of older people. And so this has been a really important initiative to make sure that at every stage of suggestions of reform, that the older person's voice is in there. And you might think that doesn't happen. What we're lucky enough to find is that sometimes what we get is a thought bubble from the department. We're thinking we might do this, would it work? They bring it in to us and we say, no way is that going to have an impact. Or communications, and so we get the chance really early. Sometimes they bring us a piece of work that's done and says, you know, how do we communicate that to older people? So my ambition for this role is to make sure that we absolutely embed the voices of older people in everything that's designed, that's provided for older people. You know the old disability saying, nothing about us without us? I think that applies absolutely to what we want to do. Yeah.
Thank you. Thank you. So, Robert, you've been in the job, 4 months since April? Not quite 4 months. What surprised you, and what's your wish list for change?
The surprise, well, in many senses about elder abuse, not a lot surprises, but the one thing that does surprise me is the lack of willingness by the broader Australian community, and indeed policymakers, to talk about the rights associated with older people. In this audience, of course, you talk about that. You live it, and it's the core. But if you go beyond this, we don't talk about it. Very rarely have I heard in the 4 months anyone talk about the rights of older people. I was over in New York with Bill Mitchell, who's here from Toowoomba, and others at an international level, trying to get governments to embrace the notion of, United Nations Convention on the Rights of Older People. But what was interesting there was even some nations not willing to really talk about the rights of older people, what they do for older people, what services they provide, but not the rights. And the same is back in Australia. Lots of governments don't talk about the rights of older people, but a lot of people don't talk about it. And I think one of the reasons, one of the problems with that is if we don't talk about rights, it allows the underinvestment that we have in this area. If you don't really, as a nation, embrace the fact that this particular group of people have legitimate rights, then the investment by the 9 governments and others will in fact replicate that. But if I can just put it in a more simple terms, practical terms, this notion about, we'll all age at home. This notion, it's a mantra now that you hear everywhere. And it was very, very dominant in the inquiry into older Australians that I did in 2010. But if you actually believe that, if you actually believe this is the way forward, what does that mean? It means the right to affordable and accessible housing, no matter where you live. It means the right to accessible and appropriate health and other care services in the home. It means the right to be able to maintain social connections so that we avoid social inclusion. So this general term of, we all want to, live at home, actually is a rights-based agenda. So my hope is that we actually ramp up rights not as some sort of academic treatises, not about some sort of remote concept, but it actually informs the way in which we deal with, deliver services. And what Anne said is absolutely at the heart of that. The ability of older people to be participants in decisions that affect them and in the systems that actually support them. And that's what's at the heart of this discussion. So I think what I want is a more rates-based approach, but one that actually informs the systems that support or should support older people going forward.
And let's bring you in here.
Can I just add to that? Because one of the things that I could have said, what worries me at night is we're all talking about we want support at home. We're all talking about that. And, firstly, you've got to have a home to have support at home. And secondly, it's the isolation that can come from that. So I'm really concerned about that as well. So, we're building a system that we think is what people want, but are there going to be unintended consequences?
Well, there are huge foreseeable but unintended consequences. One of the issues in decision making which is critical is that you look at the second or third round effect. You look at the unintended consequences. One of the most important things is people will say, well, we did this, but there were unintended consequences. But the truth was they were foreseeable. And one of the challenges for policymakers now is to actually not look at the first round effect, not look at the sort of the slogan, we all want to age in place, but to actually think about the very foreseeable but unintended consequences that flow. Now, you might then continue down that path, knowing what they are, or you might moderate what you're proposing, but not to recognise these unintended consequences, and then 10 years later say, oh yes, well, they're unintended, as if you could not have foreseen them, is in fact bad policy making and besets many of the policies that we've seen fail, both at the Commonwealth and state level. So one of the challenges in the ageing space is not to do that, is to actually be thoughtful about what the policy will do in the first round, but also what then flows, and then to either moderate it or accept that that's what you're going to have, but then you're going to have to deal with the consequences of it.
And can I ask you to be a bit more specific there, because you've got this depth of policy over decades?
Yes, I think there's a classic one. Jane Caro mentioned one about compulsory income management, completely unrelated to ageing for a moment. The first round effect of that will be to change the spending patterns of Indigenous women particularly and move away from certain forms of, alcohol and gambling. But the second and third round effect is to say to the children of those families that your parents can't manage the affairs. Government will manage the affairs. And the effect of that is you actually disempower and in fact remove the incentives for learning about how to deal with financial management. 2 or 3 generations on, you will have a much more dysfunctional group of Aboriginal people trying to manage their own affairs. I said that to Treasury at the Commonwealth some years ago. They looked at you and they all nodded. And then, of course, government went ahead and did it. The consequential effects on the next generation will be tragic. And now that's not related to ageing.
The government was taking a lot of advice from Twiggy Forrest.
They're taking a lot of advice from people. Look at the first round. That is, it moves and changes the spending pattern for one generation. But it disempowers the next generation. In ageing space, we don't have to make the same mistakes we've made in NDIS. We've learned from the NDIS what not to do. Why would you then replicate many of those aspects? The good ones, yes, but the poor ones, no, into the new aged care reforms. And I could name those, but that's more up to Anne. So the question is to make sure we understand the consequences of the decision we're making, not only in the immediate term, but longer term.
I'm going to wind it back a little bit to Jane Currow and some of her remarks, because we need to keep talking about ageism. During the EAAA's recent nationwide consultation on the National Plan combating ageism came up as the major priority for tackling elder abuse. Repeatedly, many people expressed an urgent need for a nationwide campaign. We're seeing the start of that at the moment. But to address ageism as one of the most significant drivers of elder abuse. And the power of language. This is something you're deeply interested in perpetuating harmful stereotypes. What are some of the ageist words and phrases you'd like to see eliminated, and why are they so loaded?
So Jane talked a bit about this morning, didn't she? But it's the soft way in, I think, to ageism. It's the everyday language we use that carries a tag to it. So the first one that I notice all the time is the burden language, the burden of the ageing population. You're in South Australia here, and we have high levels of older people in this state, and always I hear this burden language. And what does that do to the younger people of our community? They think they're carrying the burden of older people. And so there's an entitlement that flows from that. You know, we're the younger generation and you're the problem. So often I hear that sort of language. So I'm asking you to all join me in the campaigns of calling out these sorts of words, because it creates that impression that older people are not valued, are not useful, are not contributing, and the younger generation are carrying all the burden. So another one that's just very rife at the moment with that, the issues around health and hospitalisation, and in this state it's all about ramping, and there's a feeling that older people are bed blockers, is the language that's being used. Those bed blockers, if only we could get them out, you know, we would be able to cope. I mean, what we've known for years in health is that it's the last 4 or 5 years of a person's life that are the most expensive and where they need the most health care. But now they're being called bed blockers. And it's about then how can you get them out? And if you're a person who lives on your own, and you've done your hip or whatever, they won't allow you to go home on your own, and so you're on that pathway into residential aged care. And it's how can they quickly get you out into residential aged care. So bed blockers has that really negative connotation. And just my third one, I can't help but say this. Everyone who knows me knows that I absolutely want to blow up the word retirement. It's, you know, we're as older people all sitting here, we're not retired.
Oh, I hate it. Oh.
No, I mean...
How's retirement, Anne?
It feels like you're retiring from life, doesn't it? It's got that connotation to it. You're out of life now. It's like no value. It's really dismissive, isn't it? It's got that connotation that whatever you're doing, and I think I'm quite busy really, that, you know, you're retired. So it doesn't put any value on people past what, and it's hard to find another word, I agree, but if it's you've moved from full-time work to something else, if you're volunteering, you're actually working.
Yeah.
So, you know, I'd join my campaign, please. Try not to use the word retirement. Thanks.
And there was another one that you mentioned, and that was if you've tripped over or...
Oh, yes. So if you're in your 20s, you trip or you fall over, don't you? You know, somebody fell over. If you're over a certain age, you have a fall. You have a fall. You know, so-and-so had a fall. And the other one is, which I'm sure we can all put our hands up and say we've been guilty of this at some time. I had to put mum into a nursing home, like commodify, pick up, put. It's like it has no part of the decision. Himself or herself.
Oh, it's devoid of humanity.
Yeah, absolutely. Absolutely. So join the campaign, look out for the words, talk to the media about them. They're the ones that use them. Yeah.
Well, Robert, what's your definition of ageism? The Human Rights Commission runs ageism awareness workshops. What have you discovered? Is ageism deliberate? And what does it take to change entrenched attitudes?
So ageism is the way in which you think, you feel, and you act in relation to somebody just simply based on age and the assumptions that you make in relation to that. And so ageism is at the heart of just about all the work we do. Kay Patterson was very much able to articulate that ageism actually sits at the heart of much abuse. Not all of it, but a great deal of it. So one of the challenges that we've got in the Commission, particularly age discrimination, is, for example, removing ageism in the workplace. A coalition of three things have happened. More mature age and older workers want to work, more mature age and older workers need to work, and our economy requires more older people to work. So for the very first time in my adult life, those three things have now come together. The challenge with that is the workplaces have to be open to accept mature age and older workers in their recruitment, in the way in which they create flexible and adaptive workplaces, and then most importantly, how you have those conversations with people leaving the workforce. But it's also true in the elder abuse space, absolutely. Many of the families and communities we deal with start off talking about their loved ones, you know, how they want to support them. But after 5 years of caring or 10 years of caring, burdens, troubles, nobody supporting me, it changes and shifts, not only in language but in attitudes. But it also is in the service systems. So we've just completed 2 pieces of work which have not yet been released. One is in relation to what was talked about this morning, the Minister. We've looked at the way in which the media talks about older people in the media. And it's a terrific piece of work which we'll release at some stage. The second is in relation to ageism in the healthcare systems. And we've done a literature review. And ageism in the healthcare system, firstly, it comes about by not listening to the voices of the older person. And those that are older here will experience that. The second actually changes the treatment options. What's actually made available to you, what doctors and other health professionals will offer to you. So it actually has dramatic impacts in relation to treatment. So it's not just about the voice and choice of older people in healthcare, it's actually about the services you're provided with. We saw that in the pandemic. And the last part out about ageism is in fact rife within our public policy settings. Nearly all public policy in Australia, for most of my adult life, and I've been involved in it, was made originally by white middle-aged men. Now it's white middle-aged men and women for white middle-aged men and women. And yet the society in which I live, particularly in Sydney, in the suburb, it's multicultural, it's diverse, it's much more intergenerational than it's ever been. So many of our public policy settings, well-intentioned though they might be, if I'm being really kind, actually don't fit the environment. And the one they absolutely don't fit are older people in diverse communities. So ageism is rife, I think, within our public policy decision making. And that affects all of us now and the next generation of older people.
Now, I want to talk about those ageism workshops you've been having. And I think you identified two types of people with really entrenched attitudes that are hard to change, and others that thought, oh my God, I didn't know I was like that.
Yeah, the one thing I think that's come out of the age awareness workshops, which came out of a piece of research done during Kay's time, was those two things. Much of the workshops that we're doing, and we're doing them across government, non-government and private sector organisations, shows that the vast majority of people that participate in them did not believe that they were ageist. And they actually were shocked and surprised by the end of the session that they held these attitudes. The words that Anne talked about, they used, but they didn't have an ill intent in it. And often those words were developed in childhood, when they were teenagers, as young adults. And so that's the first one. The second one is a much more, it's a smaller group where they actually don't value older people. They don't see the value in older people in the workplace. But they probably don't see the value of older people anywhere. And one of the fundamental issues around rights is it's about respect or dignity, the dignity of the individual. And there is a subset in our society, in our workplaces, in our governments, in our service systems that do not have respect for older people. But they're a very small group. The vast majority actually want to do something, and what we now call multi-generational or intergenerational workplaces. But they're completely unaware of what they're doing is actually ageist.
Well, now a little gear shift, the dignity of risk. It's not something we're talking about a lot, but Robert, you've described the dignity of risk as a concept around capacity and vulnerability. What do you mean, and how do you see the role of supported decision making?
So dignity of risk is a term that we've used a lot in relation to people with disabilities, and that is the ability of people to not only have to have input into the decisions that directly affect them, which of course is a basic human right, but also that has to be balanced against the risks that those decisions make. And it's contextual as to time and to place and to circumstances. So it's this constant balancing. And when we come to older people where there is cognitive decline, and that is particularly for people that have 75 years and older, then it is this constant balancing of allowing people to make choice and decisions, but also recognising that sometimes they have risk. So one of the things I used to say in my last role is we are not about creating risk-free environments for older people. I can't do that. My life is not risk-free, and our parents' or our grandparents' lives are not risk-free. So the worst thing we can do is to pretend that in our service systems, our aged care, our healthcare systems, we're creating risk-free environments. That is not true. And if we do that, we will absolutely deny the ability of people to make decisions which hold risk. On the other hand, it's contextual as to the organisation. Aged care, for example, people talk about it being their home. We've had this conversation. But it's a home like no other, because it's actually not only your home, but it's actually a service provider providing a service who is legally obligated in a whole range of ways around duty of care, around standards, around all sorts of legal obligations. And so in that context, dignity takes a different interpretation. In relation to the adult safeguarding bodies like the Ageing Disability in New South Wales, that is a will and preference jurisdiction. The views of the older person who's been abused or subject to a risk of abuse has to be involved in the decisions that that commission makes, including consenting to investigations. But I can override that as a commissioner. But there are times if the person knows what is happening to them, understands the consequences of what's happening, but chooses to, in fact, continue in that environment, then you have to let them do that. And if the next day that person gets assaulted, does that mean that that decision was wrong? Well, maybe, maybe not. And so one of the great challenges for those of us that have been in decision-making roles where you value the dignity of risk and you value will and preference is that you have to live with the consequences of your decision, because otherwise it's not a will and preference. Otherwise it becomes like the child protection system, which is, of course, as you know, a best interest jurisdiction, an entirely different framework. So dignity of risk is really significant. Supported decision making is critical, because what we want to do is to allow the individual, the older person or the person with disability, to be able to input into the decisions to affect them for as long as is possible. And the only way that can be achieved is if we provide supports. Supports would actually let them understand what they're meant to be making decisions about. For example, easy read, supports for people with various sensory disabilities, right through to the appointment of support decision makers, or supporters as they're called, such as what happens in Victoria. So supported decision making is about enabling people to exercise their right to participate in the decisions that affect them for as long as that is possible.
And we're going to talk about supporters a little later on, but Anne, what kind of a challenge is supported decision making for aged care institutions, and is there a negotiation point?
So shall I talk about dignity of risk first? Because I think this is really difficult for institutions, because, you know, what we hear at Council of Elders from older people all the time is, how do we retain our agency for ourselves? How do we take control of our lives for ourselves? And as Robert said, as you said, Robert, that's about taking some risk. We all do that. And when we hear from older people, it's often families who are concerned about, you know, mum shouldn't be living alone like that. You know, what if she has a fall? You know, this is too much for her. It's in her interest, somebody else making a decision on their behalf. And I don't think any of this comes with bad intent. You know, people are concerned about each other, and we want that to be so. But if that concern then means wrap that person up in cotton wool, is that living? For most of us, we would not call that living. So in residential aged care, I think it is really difficult, because there are a whole lot of regulations, as you say, Robert, around that. And I'm hoping a goal that some of those providers of care start to work towards, to think, how can we have a conversation with that person about how to manage that? Because what we know is, in some residential aged care facilities, people can't go outside on their own unless they've got someone with them. They put everybody on walkers because then they won't have a fall. So it's how do we get the right balance, and how do we nuance that so that a regulator can make good decisions about when a person is failing in duty of care.
And I can give you an example where that affects boards of NGOs and non-profits. I was Community Services Commissioner in New South Wales, which was an oversight agency for child protection, home care, disability, many other parts, over both government and non-government organisations in New South Wales, which, as you know, is a huge system. I went to a board meeting. I did an investigation into a particular board, a disability provider. Anyway, I presented the report and they said, would you like to stay? Big mistake, big mistake. Never stay beyond your session. The next session was the consideration of a piece of legal advice by the board, which was about the workplace health and safety requirements and whether or not the disability service could continue to provide community access for its residents, people with disability. The board was about to accept the legal advice against it. And I said, I can't sit here any longer, let me just say something. You've got a choice. You can either become a jail or you can become a disability service provider. But if you make the decision to cancel community access, then that decision is you're a jail. Because all the standards, all the disability standards were about community access. Now, what was shocking about that was a board was about to accept advice was completely contrary to the mission and purpose of modern disability policy. And I have struck that over and over again. So it's not even hard-headed service providers. It's community-based boards that are so overwhelmed with, the possibility of risk and the possibility of being sued that they're making decisions that are completely contrary to the interests of the people in them. Now, in the aged care facility, the demonstration of that is the appalling practice at the moment where you can't get into some of the aged care facilities unless you provide a guardianship arrangement. Yes. Now, that is shameful, and it's now becoming normalised in our aged care system. How could that possibly be allowed by the regulator or anybody else?
So that would mean that you were under that guardian,
well,
you are not...
Yes, and the problem with that is technically you could still have a say. But what will happen is the aged care provider will only deal with the guardian. Yeah. And so from the moment you enter that facility, you have lost that fundamental right. Now, that is happening in Australia.
Your guardian
today.
Could be missing in action.
Well, the other problem is some of the guardians aren't very good, let me tell you. They're the abusers they've seen in this circumstance. But my point here is this ageism leads to, and this issue about dignity of risk actually plays out daily in our systems today. It's most extreme in the disability sector, but the NDIS has changed much of that. It's very rife in our aged care system, and it's very rife in families, particularly culturally diverse families, where the mere diagnosis, for example, of dementia almost is an interpretation that you've lost capacity at that moment. And we all know that's untrue. So it's a rife and important issue. But my point is, we are not trying to create risk-free environments. And if we try to do that, then all we will do is imprison older people. And that's nothing to what a modern aged care system should look like.
Anne, yeah.
So I think we're both moving in the direction of making sure that an older person makes as many of the decisions about their life as they possibly can. Guardians are important when a person can't make that decision. And that's why I think the notion of supported decision-making is hugely important and not talked enough about. And I think we're going to need a lot of education campaigns, a lot of talking through what supported decision-making actually means. And sounds simple, but where I think it's going to land most importantly is when a person, and there'll be more of us, has a diagnosis of dementia. Sure. So that's, dementia is going to, as we live longer, there'll be more and more people with a diagnosis of dementia. And I'm sure people in this room know that in terms of dementia, it's a huge span of diseases. It's a huge span of cognitive decline and abilities, and it needs to be really nuanced and individually focused when you're talking about supported decision making. So, for example, a person might who has significant dementia might still be able to manage most of their daily activities, but might not be able to manage the financial complexities of selling their house. But instead of focusing on what the person can do, the focus is so often on what they can't do. So a guardian is provided because they can't sell their house, and then the guardian ends up making all the decisions about what they wear and where they go and who they see and all those sorts of things. So I think we need to think really carefully about supported decision making, about the nuances, about how the variation in people's ability to make decisions day by day often, depending on what stress people are under, how confused they are about what's happening around them, taking time to help people understand what's happening to them, and to the extent possible, they make their own decisions. And so I think that's going to be a big challenge for us. And in terms of elder abuse, it means that you're not handing over to the son or daughter the ability to make decisions about their finances, about selling the house, about mum's really not able to manage this anymore. Mum, you'd be much better off if I took over your finances, if you sold a house, then your grandchildren would be able to live much better, and that's going to be much better for them, all that sort of emotional abuse that goes on. So I think supported decision making is a really interesting strategy to work on.
I'm going to move on now to mandatory versus voluntary reporting of elder abuse. Could I ask you briefly, Anne, are we ready? What do you see as the barriers? Is elder abuse well enough understood?
Oh, this is so tricky. I've thought about this. I don't know what you all think. I think that we are not ready. I worry about what's happened in child protection, where all sorts of people are reporting. The other day I think I read that 1 in 4 children are being reported for child abuse, and I just think that we don't understand enough about elder abuse. The community doesn't understand enough about what it is. Talk about coercive control, and I just don't think people know enough about that. And I worry your notion about unintended consequences in the second rung and the third rung. I think we're not ready.
And Robert, do we have the systems in place for a targeted response? Indeed, if people felt they could report, would it sort of promote a false sense of security?
So a couple of things. There's mandatory reporting of abuse by staff and volunteers in aged care facilities and disability facilities. And there's mandatory reporting in relation to staff and volunteers in home care and supports at home. So we do have a form of mandatory reporting, but it only affects abuse by staff and volunteers in those services. The question has been whether or not in those services, those schemes should be extended to report abuse by others, including family members. And I think in relation to that and in the broader issue, I agree with Anne. I think there are very perverse effects that will happen if you introduced mandatory reporting. Having been around and having advocated mandatory reporting for child protection, I know the pitfalls and the mistakes we made in that area. My view at the moment is if we were to introduce mandatory reporting in a general scale, there is no way that we have any systems that could deal with it. They would be utterly overwhelmed, and it would give a false sense that in fact we're able to deal with these. And that's what happened in child protection. We gave a false sense that reporting meant that children would be protected. Of course, the truth was far from that. The second thing is we just don't know enough yet. And if we were ever to have mandatory reporting, I think it would be very narrow and very contextualised. So I've said to the New South Wales government in my former job, and I'd say to the Commonwealth government now, it is not the right time to introduce mandatory reporting, particularly in relation to abuse within the family and the community settings. So I think at this stage, I'm not saying we should never have mandatory reporting, but if we ever do have it, we want more evidence, narrowly defined, well-resourced responses, and certainly not what we've done in child protection, because the perverse effects is it just goes underground. The other problem is in relation to CALD and Indigenous communities. The notion of mandatory reporting would send this right underground. That it is so antithetical. And I've got to say, in my last role, we used to have these forums, and on the forums would be the police as well as other community organisations such as OPAN members. at every forum, somebody from an ethnic community would get up and say, this is all very well to the police commissioner or whoever's there, we don't trust you. This happened every occasion. So the notion of reporting for some communities would just drive this issue further and further into the dark. So I agree with Anne. It's not the time, and if we were ever to do it, we have to be far more thoughtful about the perverse effects.
Well, now turning to coercive control. New South Wales was the first jurisdiction to criminalise coercive control, yet it's limited to intimate partner relationships. Elder Abuse Action Australia says this means the legislation is not only dismissive of the experiences of older people, but may also be actively harmful. Could I have both your thoughts here on the impact of the limits of this legislation? Who'd like to go first?
Couple of things. The first thing is about 10 to 12% of all elder abuse is by intimate partners, by spouses and or partners. And so the first thing is those groups are in that particular legislation because that is regarded as domestic and family violence. More importantly, they're intimate partners. Some of that abuse happens because of conditions. Some forms of dementia increase the level of sexual activity and so on, but others is just behavioural, misbehavioural aspects. In relation to what we call domestic relationships, that is where it's by a family member. The view that I've had previously and the view that I'd have now is that over time, coercive control should cover domestic relationships. In New South Wales, the undertaking was that once it was introduced on the 1st of July this year, 2 years from that date, there would be a review. And the Attorney-General assured me that at that point, there would be a consideration as to whether it should be extended. I don't think that's an unreasonable approach because coercive control is going to be very, very, very hard to actually be practically implemented. So a bit of time won't do us any harm. But there's no logic to just simply say this is only about intimate partner when the son who's living with you is abusing you, or the brother or the sister that's is abusing you. So my view is over time, that legislation should be extended. But don't underestimate it. It will be very hard to prosecute that legislation. The vast majority of prosecutions will fail in the first few years. It will take a long time for the police to get even comfortable bringing cases, and we don't actually know how it's going to work. So a little bit of time probably doesn't do any harm, but ultimately, yes, I do believe it should be domestic relationships.
What do you think, Anne?
Yes, so I agree with you. I think, people tend to think because you've got a definition of coercive control, that means that's what you regulate against. And of course, it's a different thing to actually be able to prove to the standard that's required that coercive control took place. I asked ARAS to draw the stats for the last year, and in terms of the advocacy that ARAS provided for people who we would classify as elder abuse, 46% of that elder abuse was perpetrated by a family member, a son or daughter, or might be the daughter-in-law or the son-in-law or the ex-partner, and 16% was from the spouse. So it's much more likely to be a family member, and we know those stories, don't we? I mean, we've all heard them. Of sons and daughters, particularly in financial abuse, but also in terms of the psychological abuse of you can't see your grandchildren, or you've never coped very well, mum. You've never been very good at that, and so we'd be much better at managing or whatever. So we know those stories; they're really common. And unfortunately, they mostly come from family members, the sons or daughters, which is what heads me to the shame notion of, how do you deal with the shame of that if you want to report and the under-reporting that happens. It's a cycle.
Well, do you think, and I'm just wondering whether South Australia should have this legislation, have it extended? We always, hear that you're a very progressive state. You've got a very committed
That's
minister.
like a challenge, isn't it?
Yeah.
So I agree with Robert. I think that you have to know that you're going to be able to take cases up and you're going to get some wins out of it. Because if we have this, like I in one of my lives, I was Equal Opportunity Commissioner here, and I always thought ageism was the most difficult to prosecute. It's really, really difficult. Employers kept saying, oh, no, it wasn't anything to do with his age. It was about, the fresh new views on this situation or something like that. It was really hard to get a prosecution. And I think to create the impression that you can prosecute something when you can't, doesn't help.
So I think a couple of things about that's really important. Public policy is least well served when you have regulations that can never be enacted, and we have lots of them. They're called announceables. Government needs announceables, not deliverables, just announceables. And there's lots of them happening every day in the 9 governments of Australia. I'm very good at depicting an announceable as distinct from something that actually is meant to have substance. But the point about it is that, I'll give you another example. Should we have specific criminal laws in relation to elder abuse? ACT has that. To my understanding, there's been no successful prosecution in relation to that particular law in the ACT, although it's only very early days. So it's not.
When did theirs come in?
Anyone from the ACT a couple of years ago? 2021, so it's been in a while. Now, I'm not saying that's a bad law, but in New South Wales and now at the Commonwealth level is, would I be promoting a criminal sanction for elder abuse as a specific criminal matter? I'm not sure that I would. On the other hand, I'm absolutely going to promote a criminal sanction for attorneys that breach their fiduciary duties under powers of attorney, where that is an intentional thing. So I'm not talking about somebody simply didn't know what they were doing and made a mistake. I'm not talking about people that genuinely are confused. I am talking about people that are deliberately breaching their fiduciary duties under a power of attorney. I think that should be criminalised. But none of that will matter if it's not actioned. And so at the end of the day, you've got to have some way to say, well, if you do that, who's going to be the authority that's going to take it forward? Is the DPP in the particular state or territory going to have the courage to take these matters forward? In the early days, they normally end up in acquittals. That's happened in all abuse. But over time, it makes a difference. So my point is, before you extend laws or introduce new ones, we have to make sure that firstly, they're based on evidence. Secondly, they'll have an effect that you intended. And thirdly, that the governments of the day will resource the response. Otherwise, it's an illusion. And in the area of safety, whether it's for children or women in domestic relationships or older people, we do not want the illusion of safety. We want real safety. Therefore, I think caution is the way ahead.
But I would support that. But I think you'd agree, Robert, that doesn't mean we should give up. We're turning up the volume here. We shouldn't give up. What we should do is just what you said, is build the evidence, build the community understanding of what we're trying to do, get the politicians on side and show them the way. So it's something that we want to see happening. We're just not ready for it yet. But that's why we have these sorts of conferences, so that we can build knowledge, understanding, evidence.
But what are the viable alternative legislative remedies? You think it's around powers of attorney and the misuse? And is there something else that you could see that might be an alternative?
Powers of attorney are particularly important in relation to financial abuse we see. And so it has a particular reason why at the moment we're seeing an increased level of financial abuse, which will continue, and we're seeing an increased level of financial abuse by attorneys appointed. So therefore that requires a public policy response. It needs consistency in powers of attorney across Australia, ultimately registration, but it needs others. But in relation to elder abuse more generally, which is much wider, I think there are a range of different responses. So, for example, one of my commitments is try to get all of the 9 the 8 state and territory governments to develop the adult safeguarding units that exist in South Australia, ACT and New South Wales. If we don't have that, we're never going to be able to respond to the level of abuse in a meaningful way. These are agencies that not only run the helpline sometimes, but they actually are about trying to solve and resolve issues where there is abuse, but also to be able to investigate and refer. And that's working in conjunction with the senior rights services and advocacy groups, legal aid centres around. So there's a multiplicity of responses, and I hope the national plan will promote really practical, far-reaching reforms, which the 9 governments of Australia will embrace. So the powers of attorney will only get us so far in one area. Then there's a whole lot more, and this conference is all about exploring the whole lot more.
And yes, and we're going to talk about those adult safeguarding units and the review of the South Australian one. But it's not very well resourced, is it, Anne?
You asked me in this, I'm glad the minister's not here in this
Maybe we need to bring her back.
So I think as well, this is about community understanding. And so politicians respond to where there is a strong upswelling of need. That's how they respond. So the adult safeguarding unit is in South Australia, is working well. It's working with a lot of agencies to try and raise awareness about elder abuse. But as I just want to go back to what Robert was saying about, there are a lot of sort of soft regulations in a way, aren't they? Like steps towards regulation. I mean, one of the things that the Adult Safeguarding Unit does, which is really important, is that mediation in families, where families are all fighting about what should happen to mum and mum's house and mum's money, and you've got, the sister in Queensland who wants mum to go up there, and the brother in Tasmania who wants the house sold so he has the money, and there's that level of family dispute, and that's another step towards working through with people how to problem solve what's happening.
So that's a classic illustration. The South Australian Safeguarding Unit, which is located in health but is about to change, has a very strong approach in relation to resolution. Very strong. So because most of the abuse is occurring within families, an essential part of any elder abuse strategy is, of course, family mediation. And of course, both the Commonwealth Government and state governments fund Relationships Australia and other organisations to do that. But it's minuscule to what will be needed if we're going to address that issue. When New South Wales had their adult safeguarding established, which is about both people with disabilities and older people, same as in South Australia, the disability sector was very strong that it had to do all of that, but it had to hold to account the perpetrator. In New South Wales, it wasn't just we have to do all of this social work stuff, which is 90% of what we do, and very important, working with service providers, working with the families and so on. It also had to be a means by which people that were abusing people deliberately would be held to account. So each jurisdiction approaches these slightly differently. But at the end of the day, what you need is a statutory authority in every state and territory that has wide-ranging powers, that is capable of not only taking inquiries, trying to resolve disputes, investigating matters where they are, and referring to appropriate agencies. And then you start to get a means by which you deal with it. But it's only part of the jigsaw. You need all of these other pieces as represented in this room there. And our investment as a nation is very, 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 very low. Will it grow? Yes, but it has to grow significantly because the actual demand is growing significantly. One, because of awareness, and secondly, because there is simply an increase, particularly in relation to financial abuse. So that tsunami is coming. Governments should be aware that it's coming. The banks have been telling them that for years, financial service institutions, lawyers.
Are they alive enough to it? Because
well, are you alive?
You don't like the term inheritance impatience, do you? What do you? Yeah, let's.
I call it inheritance impatience. I think that's what it is. I think that sense of entitlement that younger generation is building is, we're being portrayed in the media as the generation that is rich, that has lots of money. Now it's harder for younger people to get into the housing market, all that sort of stuff. And so it is about impatience, I think. And I think, we go back to where we started with this, saying, it's minuscule. You just said it's minuscule what they're putting into safeguarding and so on. And that is about valuing older people. If you value, we say in South Australia, I think we're a third of the voting population or something. We're a third of the votes. Why aren't we getting more traction on this?
Yeah.
Because there's a conundrum with older people. I said this in Queensland. One of the challenges in this space is this. As we get older, we become more conservative. We know that in our voting pattern. We also know that older people are the least likely to support anybody else's rights.
See, I'm not sure. I think men get more conservative.
And we would become more radical. Well, I'd like to believe that, and my experience with my mother and my mother-in-law is true, except when you look at the voting. And so when we've looked at all of the referendums and the general voting, the older population becomes more conservative. And one of the challenges for older people is if we want rights for ourselves, we older people, we're going to have to give rights to other people. So there's got to be something that changes with older people. I don't care how they vote in terms of, whether you vote for the Labor or Conservatives or for the Teals or what have you. But I do worry that a generation who consistently votes against the rights of other people, including Indigenous, then stands up in the community and says, but hang on, we want rights.
Well, let's put it out there.
You have to help me change that. How do we change that? It's not about big P politics. It's about that issue. You can't stand up and say, we want our rights respected. We want the very first principle, dignity, to be respected. But hang on, if you're a bit different, your colour's a bit different, your history's a bit different, oh no, we don't like that. And that's going to be a great challenge politically. But I'm not in the business of big P politics. This is small p politics. And it actually does matter at the moment. You're right. 27% of the Australian electoral roll at the moment is over 65. Higher in some states and lower in others. It's already a political force. But you know what? I have not the slightest idea how that political force would manifest its own agenda. I don't know. Anyway, that's the challenge. But in elder abuse, I don't think we have that problem. I think people of all ages recognise that elder abuse, just as we do with child abuse now, and just as we are starting to understand domestic and family violence, is in such an important issue where we should have a common approach and a common view going forward. But I just go back to that point. It's an interesting dilemma that older people face. If you want rights, you have to be prepared to give it to other people as well.
Anne, would you like to comment on that?
In the referendum was just a startling example of what you said, absolutely. I think that, in human rights terms, we talk about casual racism. We've certainly got casual ageism, and I think that, probably the best example of that is, say, I do my shopping for my mum, so she gives me her PIN number for her card, and I think, well, I've spent an hour shopping for her, so it doesn't hurt to put another $100 worth of stuff in my trolley for me. It's that we've got to really tackle. And that takes all of us, because we've all been in that situation. This is where we've got to ramp it up. And then if we're all talking about it, then politicians start to talk about it. So, the silence on our end. I agree with you about everybody has rights. Every single person has rights. What we're saying is our experience has been for older people, those rights are often not there.
Now, I note we've got 9 minutes left, and I'm seeing in the room some people who've been working on some great health justice initiatives. Robert, when we spoke about calls for action, you mentioned discharge planning as a critical opportunity to identify elder abuse. Can I have your remarks there on that?
See, isn't this a sensible, practical thing? Hospital systems around Australia generally have protocols that deal with the discharge of older people. In fact, New South Wales health system has a policy on elder abuse, child abuse, disability abuse, right throughout all of its health services, including paramedics. I'm sure no paramedic I've ever spoken to knows that, but it exists. But one of the things is about discharge. No older person is meant to be discharged unless they're discharged into a place of safety and care. If that system works, and it does work in some places, it is the ideal opportunity by which abuse is disclosed in a number of ways. Firstly, the obvious one is that you'll find out that there isn't a place of safety to go to. But the older person will disclose, because at that moment the family are not around. Once you're in a vulnerable position, particularly through health, you'll become much more likely to expose and talk about issues. And you've got trained social workers and or nurse care practitioners doing it. So what we've discovered in New South Wales is this is an extraordinary point of referral to safeguarding bodies and into groups such as yourself, seniors' rights and so on. If we could really develop that point, really so that it happens in every sort of healthcare facility, not only would it be good in health outcomes, which is what drove it, but it would be an incredibly important part of being able to identify older people, and I might say the same is for people with disabilities. Added to that is the health justice partnerships that exist in many of the hospitals around Australia. There's a limited number of them, but the evidence out of those is that they do remarkable work, lawyers working with hospital people. Just to explain this, but I did, with Justice Connect, whom I'm a patron of, which is a community legal centre that operates in Sydney and Melbourne, and specialises in elder abuse areas, what's called a grand round at Sydney Hospital. It's called, that's otherwise known as training, but it's called the grand round. It's like a throwback. It had the largest attendance ever in its history. Every single space, the staircases were full. And I said to the head of this, I said, I don't understand this. But what became obvious in the questions was they see abuse every day in the hospitals by family members. But then suddenly in the conversation was about their mother, their brother, their sister, their son. And suddenly what dawned on me is every audience I speak to now is not only there because of their professional capacity, it's that personal capacity. And so that is something we have in a way that often, when you're talking about abuse, you don't. It has that personal connection. But hospitals are an incredibly important place.
That's the canary in the coal mine.
Well, they see it because neglect, for example, always ends up in injury or illness. But they see it, they observe family members. The difficulty is, what do they then do with that? And one of those points is discharge.
Well, Anne, what resources would it require? What support would an older person experiencing elder abuse need in that hospital environment where you might have the abuser hovering?
Yeah, so, it means that nurses, who it most often is, or social workers, need to be aware of that and understand that and and the second thing is to make time. So I've just come off a health service board and I know the pressure on staff, not only with the bed blockers, but the pressure on staff to move people out. And so it takes time, doesn't it, to talk it through with the older person, to talk it through with families, to work out what's going on. But mostly what that older person needs is an advocate. So they need a person to stand alongside them, not to make decisions for them, but to stand alongside them, to be on their side, and you all know this, and to help them get their wishes and preferences put forward, to help them to take their part in the decision making. And that means we need those resources. And in South Australia, I'm assuming it's the same all around the place. What we need is that advocate then to be able to stand alongside that person if they're referred to the guardianship board. And in South Australia at the moment, in SACAT, we're not funded. Nobody is funded to have to provide an advocate to stand alongside
That's
that
an
older
impediment
person.
to justice, isn't it?
And that older person has really significant decisions made about them without that advocate.
So is this a call to action, Anne?
Absolutely. Absolutely. We definitely need more advocacy services. So just to make sure that the older person's wishes and preferences are forefront and decisions are not made about them without them being able to take part. And I think that's the same around Australia, is it, Robert?
Sort of, yeah. Yeah.
Sort of, okay.
I mean, there's a real reluctance by governments to embrace advocacy for older people because of the resource cost.
Yeah.
So advocacy for people with disability going through the law and justice systems is improved.
Yeah.
Advocacy for children going through those systems
family court.
has improved. But a number of submissions by you and others have been made to various inquiries about
Will you
formal
run with
advocacy.
this, Robert?
It is, but the answer is yes, because it's particularly in the law and justice area. One of the great challenges at the moment is that older people are disproportionately affected by various decisions about them, you know, the guardianship and tribunals, mental health tribunals, but also even in the criminal justice system as well. So advocacy is really important. It comes at a high price, and the evidence base for it, I think, still needs to be developed further. So you won't get it over the line, and we can demonstrate that you've got a targeted approach, that it's going to have real benefits, and that it's manageable in terms of cost to government. But the real challenge is to actually show that it is necessary, and I think it is. If we can demonstrate it in the other areas, then I think it's only a matter of time to do that.
And ARAS is taking that up in South Australia, is trying to push that forward, takes up cases when they can, but there's no specific funding around it, and it could be large, but as you say, Robert, we need to collect the evidence from that about what's changed, how important it is, and then to be able to advocate really strongly to government around it.
Thank you. We've gone to a few dark places and some interesting places during this conversation. And I just want to wrap up. We've got a minute each. And just what gives you reason for hope? Who'd like to go first?
Oh, thanks. I'm always hopeful. I've been around a long time, as you can tell, and you don't do that unless you're a positive and hopeful person. But I take hope from some of the really, really strong intergenerational programs, because I think it's really important that we get to younger people. I hate the divisiveness that media tends to get drawn into about older persons versus younger persons. So I take my hope from that. I do think that things are changing. They're never as fast as any of us would like, but we can look back 10 years and see that things are changing. But mostly I take my hope from this huge audience here and the people online, and think you're all committed enough to come here and spend a couple of days and to work on this, and that's what we need. We need, masses of you working, of us, all of us, working on this together, and we'll get there. We will.
And I used an expression with Philippa, which was about the night sky. If you go out into the night sky, you can be overwhelmed by the darkness, or you can find hope in the stars. And I think you and I in this room are people that seek those stars. And there's no question in my mind, just even in the last 5 years, but longer when I listen, that there are extraordinary improvements that have been made. If we look across the 9 jurisdictions now, including the Commonwealth, we are seeing buy-in by governments in different way. The Commonwealth Government's campaign today in relation to raising awareness, the national plan, the number of organisations that are now funded, not adequately enough, across the 9 governments is encouraging. The fact that we do have 3 adult safeguarding measures, the fact that we've got public advocates in every state and territory really pushing these issues, and your own presence, as you say. So if you look look at an area of public policy, and I've been around public policy a long time, we see a lot of very good things happening. What we've got to do now is build that to scale. And that's going to require enormous investment relative to where we are today. So I think we've got the makings of what should be. Not all the gaps are completely filled yet, and hopefully the National Plan takes us down one step further along that line. But the truth of the matter is, the enthusiasm that you bring in the organisations you bring, together with the support of governments, which is essential, I think does give me hope. The one thing I'm not hopeful about is the level of abuse. I think it will continue to rise for some time. But our capacity to respond to that, I think we've got the makings of something very significant, but it will require significant investment way above what we're doing at the moment.
Well, thank you very much, Robert and Anne, our stars. So thank you so much.